Hi, everyone. My name is Kristine Spicer. We could talk about vitamins and supplements for the next 3 hours, really, because there are a lot of different products on the market. So since we don't have that amount of time today, or attention span to really dive in that deep, we're going to talk about some basic stuff. But when today is done, these 6 topics that you see on my screen are basically what you should be a little bit more familiar with. Overall, we're going to talk about nutritional vitamins and supplements and how you might benefit from them. We'll talk about why you should take them and who might be a good candidate to take supplementation. Tips on what to look for, what questions you should be asking, how to buy, and things to consider when shopping for vitamins and supplements, and some overall general rules to keep in mind, because there'll be a lot of information that I'm going to share with you today. And it can be a little bit complex and hard to understand. So I'll wrap everything up by just giving you some general things to think about. So I could just end the topic here today, right with this slide, with the question of why. Why would we take vitamins and supplements? The answer, the very quick and dirty, simple answer is that vitamins and minerals are essential to helping your body develop and function as it should, all the way down to the cellular level. So everything else that I'm going to go over today, the big answer is that our entire bodies down to the cellular level need vitamins and minerals and supplements to do the job that it needs to do. Now, most of us do get what we need from our diet and by eating healthy, but there are a lot of us that need some extra nutrient boost. So we'll start with the most common, which is the standard multivitamin. This is something that almost everybody has heard of. It is the basic vitamin route. Multivitamins usually contain 3 different categories or 3 different subparts. You've got fat-soluble vitamins, water-soluble vitamins, and then minerals. So fat-soluble is very easy to remember. There's only 4 of them: vitamin A, vitamin D, vitamin E, and vitamin K. So we often refer to them as ADEK, A-D-E-K. Fat-soluble vitamins, they have to have fat to dissolve, and they're also stored in your fat tissue. They're stored in areas of your body such as your liver, your fat tissue, and your muscles. And they can be stored long-term there. Water-soluble consists of 9 different vitamins. Those are all your B vitamins, which are folate, thiamine, riboflavin, niacin, pantothenic acid, biotin, B6, and B12, and then also vitamin C. Now, water soluble means that they have to have water to dissolve. And once they dissolve, they absorb and then they dispose. So water soluble, you can think of it this: dissolve, absorb, dispose. So a minute they dissolve, your body absorbs what it needs, and then the rest is disposed of through your urine. Your body does not store water-soluble vitamins at all, and you have to replenish those every single day, either through your diet or through supplementation. Minerals such as magnesium, calcium, iron, copper, selenium, and zinc are also, for the most part, water-soluble. So really the only difference you need to remember is fat-soluble and water-soluble, with fat just being those 4 up there, A, D, E, and K. Everything else your body dissolves, absorbs, disposes of. So supplements, like I said, we could spend the next couple of hours going in depth about tons of different supplements on the market, but we're going to stick to 1, 2, 3, 4, 5, these 7 topics here. Actually, there's 8. I think our screen is covering up 1. These supplements here are probably the most common. The most questions I'm asked about are about what we see here on the screen. So we have fish oil, turmeric, glucosamine and chondroitin, probiotics, natural sleep aids such as melatonin, magnesium, and valerian root, echinacea, coenzyme Q10, and I think the bottom one is CBD. Yep, CBD or medicinal cannabinoids. Don't worry, I have another screen that goes over that. So first, let's talk about fish oil. So fish oil, or omega-3 fatty acids, come from fish. They contain a component called EPA and DHA. Fish oil are thought to be heart healthy. They help with blood pressure. They help in lowering triglycerides. They help with brain health, joint health, and thought to help with hyperactivity in children. There is a recommended dose for fish oil daily, and that's between 1,000 and 2,000 milligram of the EPA DHA. And this is why it's important. This is a good example of why it's important to read your labels and watch your ingredient lists, because some fish oil products on the market will have other omega-3 or omega-6 fatty acids in it. And you'll see a strength on the front of the bottle, but that will include everything that's in that ingredient list. But to get the true benefit of omega-3 fatty acids or fish oil, you're looking for the combination of EPA and DHA. And you want between the 1,000 and 2,000 milligrams of those two omega-3s. Now with fish oil, this is one of the products where quality does matter. And if you've ever taken fish oil that has a strong fish odor, or you end up burping it up the next day, you know what I'm talking about, because fish oil really needs to be distilled. You could benefit from it being flavored because it is fish oil. And if you have a lower quality product, or you have a product that doesn't have as much EPA or DHA in it, you have to take more capsules per day to equal that milligram strength. And if you have a product that's not as good of quality, you end up burping up that fish oil the next day or so. Now, most people can put up with that for a little bit, but long-term, that will be something that you would get tired of. So when looking for fish oil, what you want to look for is something that's molecularly distilled, because we don't want any toxins in our fish like mercury. You want something that could be flavored, so it doesn't have that aftertaste. And you want something that has good potency in it, so that higher strength EPA or DHA. You look at your ingredient list. If you can achieve that in 2 capsules per day, that's a pretty good product. But a lot of products will say, and you can take anywhere between 2 and 6 capsules a day. And they're pretty big capsules, so that's quite a dose to take. So that's important to remember about fish oil. The next is turmeric, also known as curcumin. It is the yellow spice found in curry powder. So it is a natural anti-inflammatory. It's very good for joint pain and joint inflammation. You can either take it as a dietary supplement, putting it on your food, or you can take it in a capsule form as a nutritional supplement. So if you're looking to achieve that anti-inflammatory effect, the amount that you have to take probably is not feasible by adding it to your food, unless you like curry on all your food, breakfast, lunch, and dinner. Otherwise, you can take it in a capsule form, and it does take up to 12 weeks before you see any change or any anti-inflammatory effects. You're looking at taking between 1 to 2 grams daily of that. Next is glucosamine and chondroitin. This one is a very common supplement used for joint and cartilage health. Glucosamine protects cells called chondrocytes. That helps to maintain cartilage structure and cartilage health. The chondroitin also helps to lubricate your joints. This is also something that you have to take long-term, and you don't see any results for quite a while. Caution with this product is patients that have glaucoma or that take warfarin. You have to be very careful with this, as it could make glaucoma worse, or it could have a drug interaction with warfarin. So that you have to be careful of. So next is probiotics. Probiotics are my favorite supplements. My favorite supplement to talk about, to teach about, and to tell patients to take. And the reason for that is because probiotics help with gut health. And gut health, or stomach health, GI health, is very, very important. So probiotics are also known as good bacteria. And our entire intestinal tract, from the top all the way to the very bottom, is regulated by good bacteria. The bad part is our gut also has bad bacteria. So sometimes if those can be out of sync with each other, and you have more bad bacteria than you have good bacteria, you have side effects or problems as a result. That can result in diarrhea, or conversely constipation, abdominal pain, excessive gas. It could even lead to chronic fatigue, brain fog, and sleep disturbances. So some of the things that will cause your good bacteria or your bad bacteria to outweigh your good bacteria, the number one thing is antibiotic use. So if you become ill or sick and you get put on an antibiotic, the thing to remember about antibiotics is they are not prejudiced. They kill both bad bacteria and good bacteria, both at the same time. That really becomes a concern if you're on repetitive courses of antibiotics. If you do not, if your illness does not resolve, if you don't get better, and you continue to take antibiotics, that will continue to kill the amount of good bacteria in your gastrointestinal tract. Stress will do it, and other GI conditions can cause your good bacteria and your bad bacteria ratio to become imbalanced. So probiotics is an excellent way to replenish all the good bacteria into your intestinal tract. And if you get out of balance because of those antibiotics, or an illness or injury, it does take about 2 to 3 weeks to build your good bacteria back up. And probiotics, there's a lot of them on the market. So many different brands, many different things to look at. Probiotics is one thing or one supplement that the higher strength that you can get with the most species in it, the better the quality of the product. There's a wide variety of probiotics on the market. You have very simple ones that have one strain and are very inexpensive, and you have very complex or high dose, which are much more expensive, but they have multiple strains of good bacteria at higher doses. So if you're really struggling with any of these GI side effects because of antibiotic use or stress or whatever the case may be, a higher quality probiotic is what's going to be needed to replenish that GI tract. Gut health is extremely important. Yes.
Do steroids also cause issues?
Steroids can, yes.
Okay.
Yep. Yeah. So a lot of things can. Antibiotics can, steroid can, stress, sometimes other prescription medications, illnesses, injuries, conditions of the GI tract like autoimmune diseases, Crohn's, celiac, different things will cause an imbalance in the GI tract. And probiotics, you know, when you assign that you're having a side antibiotic or something is diarrhea. So when that happens, then you start to replenish the probiotic. Now you get probiotics in certain dietary things like yogurt, but there's not nearly enough. You would have to eat so much yogurt to get the amount of probiotics you need. And then you're offsetting it by the sugar in the yogurt. So it doesn't become a healthy scenario. It's much easier to supplement with a higher dose probiotic.
You ever
Yes.
take too much?
You really can't. You really can't.
But they just switched my Prilosec to Botanic.
Mhm.
So would this be up my alley?
So those are proton pump inhibitors, and we're going to talk about medications and how they affect absorption and digestion. So, but quick answer, proton pump inhibitors changes the pH of your stomach. It doesn't necessarily affect bacteria in your intestinal tract. It may change how you absorb or dissolve your products, but it won't affect the bacteria. But do I think probiotic is a good idea? I always think probiotics are a good idea, because if your gut is unhealthy, you don't feel good. 80% of your immune system is housed in your gut. So if you have an unhealthy gut, your immune system could be damaged, which means you're more susceptible to coughs, colds, viruses, those sorts of things.
So would that also go along with chemotherapy for colon cancer?
Yeah, anything that's going to destroy the natural flora in the GI tract. So, and even healthy people can benefit from probiotics. You know, there's a lot of different like food sensitivities out there that people experience that they don't know about that can cause bloating and delayed reactions. And probiotics will help to keep that under control because they help prevent yeast overgrowth and bacteria overgrowth. So,
And is a pill form or capsule better than the liquid?
so you can get probiotics in a capsule form or usually like a powder that you mix with a liquid,
Okay.
and either one would be fine.
Okay.
Yeah, the
Yummy.
dosage form doesn't really matter,
Okay.
because they're both gonna dissolve in the stomach and GI tract.
So have you seen an individual with all of our different maladies within your practice that you would say, no, I would not have you on probiotics? Or is this just this is something everybody really should be taking?
The only time I would say, no, you shouldn't take it is if they took it and had some sort of adverse reaction. And we wouldn't know that until you tried it. Not saying that doesn't happen, because we all have different things going on. And then there's also different brands too, so you could try other things or
Mhm.
different brands of it. So
Is there one brand better than the other, or just more based on you having a reaction to?
there are, yes, there are brands. I'm not gonna name a particular brand, but what you wanna look for, is a higher quality product. So we'll talk about this at the end, the difference between quality of products. So, you're looking for like a pharmaceutical grade, you're looking for a high dose, multi-species type product. And there's gonna be lots of manufacturers out there that, qualify or that meet all those characteristics. So, but there's a difference, and when it comes down to quality, which we're kind of jumping ahead. I mean, that old adage, you get what you pay for, is very, very true when it comes to supplements. Okay, so next, natural sleep aids.
On that
Yes,
one that says calm, is that the name of it that you want?
yep, I will get to that in just a second. But natural sleep aids, so we know that in our world, sleep is very, very important. Rest is important for our brain and our body to heal, to recover, to grow, to do process memories, to do everything we need it to do. Many people have problems falling asleep, many people have problems staying asleep for whatever reason. So natural sleep aids is a more natural way to go about treating it versus prescription sleep aids, which could be addictive, or have some side effects to them. But natural sleep aids, you're referring mostly to melatonin, magnesium, valerian root, and CBD. So melatonin is a hormone that your body produces normally anyway. Basically, what it does is it just tells your body, your brain that, hey, it's time to go to sleep. Magnesium, especially magnesium glycinate, is a element or is a mineral that helps with anxiety. It helps with relaxation. It will help with stress, decreasing inflammation, and therefore also helps with sleep. I get asked a lot, what is the dose of magnesium? So it's between 250 and 500 milligrams a day of what you can tolerate. Magnesium, especially different forms of magnesium, can have a little bit of a laxative effect. So I would start on the lower side and see how it's tolerated before starting at any max dosing. Valerian root is an herbal product. Same thing, it has more of a sedative type effect. It helps you relax to fall asleep. The downside to valerian root is it does seem to have some side effects such as upset stomach and headache. So if you experience that, I put up there Calm. Calm is a brand. It is a combination. There's a couple different types of out there. But it's usually a combination of magnesium, melatonin, and sometimes it'll have L-theanine in it, which is an amino acid that also has a calming and relaxing effect that helps with sleep. Lastly on there is CBD. CBD helps to regulate the sleep cycle and helps you stay asleep. It's not a sedative. It won't help you fall asleep, but with time, as you continue to take it, it helps to regulate your sleep so that you stay asleep. So if you're one of those people that you wake up at 3 or 4 o'clock and your brain thinks you need to go to work or you need to answer the phone or you need to write your to-do list down, that helps get rid of that. So CBD helps you to stay asleep.
What about CBN?
CBN is also a medicinal cannabinoid. It actually works better than CBD for sleep.
Does it also like over time, or is that one that will actually help you fall asleep?
Nope, over time.
Okay.
Yeah, they're all medicinal cannabinoids are all together, all linked together, and they work the same way. Next is echinacea. I'm sure everybody's heard of echinacea. They always say if you're sick, strengthen your immune system with echinacea. That's an herbal product as well. It does show to support the immune system by decreasing your symptom days and helping you beat that infection a little bit sooner. It is recommended that you don't take it any longer than 8 weeks. And it does seem to have a few side effects as well. The stomach ache, the headache, dry mouth, and even sleeping disruptions. So if you're already having trouble sleeping, echinacea may not help that at all. Next is coenzyme Q10, also known as ubiquinol. So this is a really good and important supplement. We have it in our bodies already. It's involved or found in every single one of our cells. It helps to convert our food into energy. It has neuroprotective effects. It's a very strong antioxidant. It's very important for brain health. It's thought to slow neurological conditions and help protect our brain against oxidative damage. Coenzyme Q10 is depleted by a couple different things, one of them being age, one of them being nutritional deficiency, and then one of them is a class of drugs called statin drugs. So if you've ever heard of statins, I'm talking about like atorvastatin and rosuvastatin. Those are drugs that are prescribed to help lower your cholesterol levels. They're very, very common. Also known as Lipitor, Crestor, Pravachol, some of those. The body or that prescription drug depletes the body of coenzyme Q10. So it is recommended that if you take a statin, you take CoQ10 right along with it. So that way you don't deplete your body of this very, very important supplement.
Is there a dosing recommendation?
So it's at least 100 milligrams a day, and it's up to 300. If you don't take any prescription medications, you can get away with just 100 milligrams a day. But if you take a statin, then the higher dose is what's recommended, because it just strips the whole body of it. So. And then lastly is CBD or medicinal cannabinoids. So when I say medicinal cannabinoids, it really is referring to everything that's within that hemp plant, which is CBD, CBN, small amounts of THC, and several other medicinal cannabinoids. They all work together synergistically to produce an effect in the body. And in our bodies, we have what's called an endocannabinoid system. And these products, that endocannabinoid system responds to these products. And I could have a whole presentation, and I probably will at some point in the future, just on the use of CBD, CBN, and medicinal cannabinoids and how they work in the body. But here I'll just mention that the most common uses are pain and inflammation, anxiety, and sleep regulation. These products are not addictive. They're very well tolerated, and they can be taken with other medications and supplements. They are pretty effective at what they're using to treat. So it does take a little dose adjustment to figure out what's going to work for you. But again, that's, that would come along with, a whole nother conversation about medicinal cannabinoids, but it's a very useful supplement. And it has a lot of potential.
Is it useful for use treatment for nausea and or appetite increase?
Not really. No. I know where you're going with that. Like THC is used for appetite increase and a little bit of nausea. The other THC, the main ingredient in like marijuana, that's a medicinal cannabinoid as well. That's from the marijuana plant. This one's from the hemp plant. And it doesn't seem to have much effectiveness against with appetite.
Either one.
Either one or nausea. No, it seems to focus more on these other things like the pain, inflammation, anxiety, fibromyalgia seems to be very effective at, and then sleep regulation.
But the THC would help with nausea and appetite. It may.
Yes.
May.
Yeah. A much higher concentration of THC.
Right.
But then when you have the higher concentration of THC, you've got some other effects that go along with that too. So. Okay, so then you have to ask yourself, why should you consider taking supplements? Well, some patient populations may need a higher amount of vitamin nutrients. And that may be patients that have certain chronic conditions, certain GI issues, it may be the older population, it may be populations that don't have access to healthy foods where they can get nutrients net. Absorbed and absorbed. And then there are certain metabolic functions and certain conditions that require certain vitamins and minerals to function. And then lastly is what we call nutrient depletion. So nutrient depletion is a process where you would take a prescription medication and it strips your body or depletes your body of certain nutrients. And a couple of well-known examples are, for example, the drug metformin. If you've ever heard of that or even take that, it is a first-line therapy for elevated blood sugars in patients that are newly diagnosed with type 2 diabetes. Really helps to control the blood sugar, but it also strips the body of B vitamins. So it's recommended that you take a B complex along with metformin. Statins, we just talked about that. Statin medications strip the body of ubiquinol or CoQ10, which is very good for the brain. So that's depleting your body of certain nutrients. Proton pump inhibitors, like you mentioned, Prilosec or Protonix or Nexium, any of those. Proton pump inhibitors are used to treat gastroesophageal reflux or heartburn or GERD. And how they work is they turn off the itty bitty tiny little acid producers in your stomach, microscopic little acid pumps, and they turn those off. So that means the acid production in your stomach drops, and that's how they work. That's how they treat the reflux or the heartburn. Well, when that does that, it changes the amount of acid in your stomach and changes the pH of your stomach. That then has the potential to change how you can absorb certain nutrients from your diet or from certain supplements. Now, proton pump inhibitors by design were only meant to be used short term. But what we have seen since their invention is that's really not the case. Most people are using them long term, either because they have long-term problems or because they get put on them and forget to be taken off of them or try to be taken off of them. Or they have a diet that aggravates their GERD or their heartburn, and proton pump inhibitor is the answer. But the thing to keep in mind is when you change that pH in the stomach, you're changing how things dissolve in the stomach. And then therefore you're changing how they absorb. So proton pump inhibitors are very much a cause of nutrient depletion.
Does the probiotic taken with the proton pump inhibitor kind of help offset that? Or?
It does not, because a probiotic doesn't have anything to do with the pH or the acid content of your stomach.
Okay.
The probiotic is simply just good bacteria.
Okay.
You can think of it like the little warriors in your intestinal tract that are keeping the bacteria or the bad bacteria at bay. Whereas, and that's more important in your intestines, your small intestine, your large intestine, and your colon. Your proton pump inhibitors work in the stomach to decrease that stomach acid. So what our stomach acid is used for is for dissolving our nutrients, our food and the stuff that we eat.
Okay.
But too much stomach acid, or if you have any type of stomach irritant, can creep up and give you GERD and heartburn. So that's why we take those products, because that's uncomfortable. Nobody wants to experience that.
I'm taking baking
Protonix?
soda.
Okay.
I thought that was for the acid and stuff like that.
Yep, that will neutralize it as well, but the Protonix
Mhm.
is doing the same thing.
So both, because I'm doing both.
Mhm. Yep.
Okay.
Yep.
Curious.
Some people will do baking soda, like if they're not taking any medication, if they just have an incident of heartburn or whatever, they'll take a dose of baking soda just to kind of extinguish it. And that's fairly common. But the Protonix is essentially shutting down all the acid in the stomach.
Is there certain supplements that are more important to take when you take something like Prilosec?
So taking supplements is what's important, because you may not be absorbing it from your diet. So if you're on proton pump inhibitors where it's changing the pH of your stomach, maybe the quality of products that you're taking, or the fact that you should be taking a supplement to begin with. So a lot of people don't take supplements, but they're taking the proton pump inhibitors. Therefore, what is in their diet is not being absorbed properly. So they need a supplement above and beyond with a vitamin or a nutrient of some sort. Okay, so who should consider taking supplement? Well, the answer to that is very simple, everyone. I could be done with that. But especially anybody that has any type of calorie restrictive diet. So whether you're on a diet because of a medical condition or to lose weight, whatever diet you may be, often restricts the amount of calories or the food that we eat. Sometimes that can play a part in what nutrients we're putting into our body to absorb. So any type of calorie restrictive diet. Women who are or who might become pregnant, your reproductive years, it's really important to take good vitamins and supplements. People who are sick, injured, or recovering from a surgery. Your body is fighting really hard to get better. So adding vitamins and supplements is really an essential time for that patient population. People who can't or don't eat a variety of different foods, maybe because of food allergies, maybe because of some sort of GI issue like celiac disease. If you have any of those types of conditions, that really limits what you can tolerate to eat. And then if your diet is limited because of that, then you won't be benefiting from the nutrients within your food. So you could then benefit from a supplement. Or if you follow a special diet, such as the vegan diet or a vegetarian diet. So how do you know what product to look for? Well, it's a good question, but first of all, let's figure out what's your goal. What is it you need to accomplish? What are you looking for? Are you looking just to supplement your diet? No other conditions or no other concern? You want just something to supplement the food intake that you already have? Do you need to correct an electrolyte imbalance? Do you need something specific like bone protection? Do you need help with hormone balances or imbalances? Are you looking to heal certain issues such as gut issues? Or do you have a particular condition you're looking to improve, such as insomnia or muscle cramps? So first of all, you got to figure out what you're looking for and what your goal is. Or do you take prescription medications that could be depleting your system of some of these nutrients? So figure out which angle you're looking for, and then that will help you determine what type of vitamin and supplement that you could benefit most from. If you're simply just trying to supplement your diet, supplement the food intake that you have, a good multivitamin with minerals should do the trick. If you're looking for something extra, like to protect your bones, which a lot of women are, on top of your multivitamin with minerals, you're going to add extra calcium with vitamin D. If you're looking for any type of hormone balance, such as proper thyroid balance, you're looking at for things, minerals like selenium and zinc. For example, selenium and zinc are they're very important and essential for proper metabolism from T4 to T3. And then back to the gut, if you have any type of gut disruption caused by various issues we already went over, you're looking for probiotics and digestive enzymes. You got muscle cramps, you're looking for something like magnesium, or insomnia, something like magnesium and melatonin. So it really depends on what your goal is. So that's your first question, is what ailment or what do I have that I want to improve? So you should be asking a few questions when it comes to trying to pick out a supplement. Number one is that drug-induced nutrient depletion. First of all, if you take prescription medications, that should be the first thing you look at. And probably that's not going to be an answer that you're going to have when you ask yourself that question. So if you want to have more information on if the prescription medications you're taking are depleting anything, the person that you need to ask is your healthcare provider. You can ask your medical provider. If they're not familiar with that answer, then you ask the pharmacist. So we have all that information as far as what class of drugs deplete what things in the body. So you can look at your medication list, and that's the first question. Am I taking anything that's stripping my body of essential nutrients? Do I have any conditions that could benefit from supplementation? Like we just said, do you have any hormone imbalances that can benefit from supplementation? Do you have any gastrointestinal issues that are affecting absorption that you could benefit from supplementation? You should be asking, are there any drug interactions between my prescriptions and supplements? So for the most part, drug interactions are very minimal when it comes to over-the-counter vitamins and nutrients. But the important thing to remember when it comes to supplements, any type of herbal, the studies and the data out there are somewhat limited. So there's usually enough to guide us as whether we should say yes or no, you shouldn't take that. But that needs to be compared with your medical conditions and your prescription drug list for sure. You should ask, am I taking my supplements correctly? Am I taking them at the right time? Should they be spaced out? Or could I take all 10 of my supplements with 1 glass of water and call it good? So there are little intricacies about different vitamins and supplements that would warrant them being spaced out. So for example, your fat soluble vitamins, they really do absorb best in the presence of dietary fats. However, your water soluble, those dissolve and absorb better with a full glass of water on an empty stomach. So there's a little bit of controversy there because they're all usually in one tablet. So what we usually recommend is if you can stomach it, to take your vitamin on an empty stomach with a full glass of water. Sometimes we realize that can cause some stomach upset. So you can offset that by taking those at bedtime with a full glass of water. And as you're sleeping, they're dissolving, absorbing, and you're not even aware of any type of stomach upset for the most part. Different things should be avoided or taken together. For example, iron and vitamin C should be good together because they help each other absorb. So it's important to know certain things about your vitamins. You also want to know what affects supplement absorption. So it's one thing to swallow a supplement or a nutrient, but it's another thing for it to dissolve and absorb and for you to get the most out of that product when you're taking it. And there are things that will affect that. GI issues, stomach surgeries, taking it at the same time as caffeine or alcohol, taking it at the same time as smoking, taking it at the same time as other medications or your other handful of vitamins or anything like that. Okay, so how to shop, how to buy, and how do you determine what's good products and what's not good products? Because there's 1.5 million of them on the shelf themselves. So quality is a concern. Now, obviously, if you're going to go down the road of taking vitamins and supplements, there's a reason for it. And you don't want it to be for nothing. You don't want it to be wasted. So quality is a concern. There are 3 different categories of products on the market. There's what you call feed grade, food grade, and pharmaceutical grade. So feed grade is mostly for animal consumption. So I don't really talk about feed grade, but for today's purpose, I brought it up. The supplements that you find in the store are either food grade or pharmaceutical grade. So food grade means they're approved for human consumption. And pharmaceutical grade means they're approved for human consumption as well, but they meet higher standards. And the difference is vitamins and supplements are not regulated by the FDA like prescription medications are. However, the FDA does have guidelines such as good manufacturing processes in place that they want to be met. And that will determine if it's a pharmaceutical grade or a food grade product. So pharmaceutical grade, that is the best product that you can get. In order to be labeled pharmaceutical grade supplement, it has to be 99% pure. It can't have any fillers, any binders, any flavors, or any excipients in it. It has to be 100% pure. Now, a quick way you can tell is if you have a vitamin product, I should have brought some examples, but I didn't think about that. If it's a capsule or if it's a tablet. A capsule is more likely to be pharmaceutical grade. A tablet is more likely to be food grade. If you think of like an example like Centrum Silver, a tablet has to have fillers and binders in it for it to be a tablet. You have a subset of powders. In order for that to be in a tablet form, there's got to be a binder in it. There's got to be a machine that compresses that all together to make sure it's in tablet form. That's a food grade. The FDA determines that pharmaceutical grade can't have any of that extra stuff in it because excipients and binders and fillers can affect how your nutrients dissolve and absorb. You want your vitamins or your supplements to dissolve in your stomach within 30 minutes. If they don't dissolve within 30 minutes, then they just keep on going and they end up in the toilet. A capsule is going to absorb or going to dissolve very quickly, and it doesn't have any of those extra fillers in them. But as cost-wise, the cheaper the product usually means the lower quality. So pharmaceutical grade, of course, because it has to meet higher standards, is usually more on the expensive side. But you get more bang for your buck because you can guarantee that much more of that product is actually being absorbed in your system, which is the whole idea. There are some differences in manufacturing. You've got multiple companies that make vitamins, different brands. They have different formulas. They have different inactive ingredients. They have different binders, different fillers. They have different compression rates. You could take 2 identical products and they may have different rates at which they dissolve in the body and amount that actually gets to you. So manufacturer quality is of importance. So kind of that adage, you get what you pay for. If you buying mass amount of vitamins online through some unknown vendor, the chances of that being a lower quality product is pretty high. So there's a lot of information. There's a lot of things to remember. But just to make it very simple, what you can do is you just follow these general rules. Number one, just stick to, if you don't know what to take, if you don't know what dosage to take, just stick with the recommended dosage unless otherwise instructed. You want to avoid caffeine and alcohol at the same time as you take your vitamins. Caffeine, you want to separate by at least 4 hours. You want to take fat soluble with dietary fats if possible. You want to take water soluble with a glass of water on an empty stomach if possible, or a small amount of food if you have some stomach upset. And then you want to avoid smoking at the same time that you take your vitamins as well. However, if you quit smoking altogether, the benefits of that greatly outweigh taking vitamins anyways.
You said caffeine, not within 4 hours?
Yes.
I was like, oh, my morning coffee.
Yeah, that's
I wake
when
up,
I,
Take your vitamins at bedtime.
that's what I was just made a note of.
When is it too many vitamins?
When is it too many vitamins? Well, that's a good question because most of them are water soluble. So if you're taking them all at once, you may be wasting a lot more than you're actually absorbing. You can spread them out throughout the day, then the body absorbs a little bit as the day goes on. There's lots of supplements out there. There's good multivitamins, there's herbals, there's everything we covered here. There's lots of other things. There could be reasons you take everything. You take all of it.
I take a handful first thing in the morning,
Mhm.
and then I take a couple more later,
Mhm.
but, by spreading them out,
Mhm. Especially the water soluble ones. You take some in the morning, some at bedtime.
which ones, which ones are which?
Well, it depends on what you take. Remember, fat soluble or just A, D, E, and K. Those are probably in your multivitamin.
I'm talking about like the script. How would I know?
So you're talking about prescription.
Mhm,
So I guess I'd have to know what prescription you're taking.
Right,
To be able to,
5 or
Advise them.
6 of those.
so we're talking about vitamins. So your prescriptions, a lot of those can be taken all at once at the same time because they're all doing different things.
But if we have these questions, we could probably come to you at your office.
That's more
or
of a personalized,
Our pharmacist,
Yeah.
if it's not.
Yep.
paid.
Yep, your pharmacist. That's more of a personalized question. You really need to know what we're talking about and compare it to, you're taking proton pump inhibitor. So is that affecting the dissolution rate or your stomach emptying of, other things? So there's things you got to really look at individually with prescription medications.
Okay,
So when you
Somebody
say
said-
when you say caffeine, like your coffee,
Mhm.
that affects the absorption rate
Mhm,
versus a glass of water.
mhm.
Okay.
I'm not saying don't have caffeine. I'm just
Well,
saying
I'll
change
still
your
have to have
vitamin.
my coffee. I'll just take the vitamins at
Yeah.
night with my glass of water.
There you go. Yep. Okay, still don't know what to take. Here's your top 5. So top 5 supplements for optimal health are number 1, a good multivitamin with minerals. Number 2, vitamin D. We live in a region of the world where we see a lot more darkness than we see daylight. So we are not getting adequate amount of vitamin D from the sun. So supplementation is almost warranted for everyone for the most part. Magnesium, fish oil, and then probiotics for gut health.
Any form of magnesium, or is it the one you said earlier, the
Glycinate. So it comes in multiple forms. It comes in citrate, glycinate, sulfate, oxide, and about 4 other ones that are less common. So when you go to the shelf, most of the time you're gonna find magnesium sulfate and magnesium oxide. So they all have different absorption rates. So magnesium oxide raises your levels the least amount. Magnesium glycinate is probably one of the better forms. Magnesium sulfate is pretty good. Magnesium is used to increase your magnesium levels. It's used for muscle cramps because a lot of products will use magnesium topically, which we use that in some of the compounds we do for topical pain. It helps to relax smooth muscles. So leg cramps and stuff like that. And it has that calming effect. So for sleep and anxiety, to take that magnesium at bedtime. But magnesium also has a laxative effect too. So you have to go, what do I say? Go low and go slow until you know how it's going to affect you. Last thing I want to do is recommend magnesium and the next day they come back to me like, wait a minute. That didn't go over well.
so,
So what did you say were the best for magnesium?
So they're all do different, but you can do magnesium glycinate or magnesium sulfate.
it'd be a real good idea to visit you and have a one-on-one and we could hang out in that section of the store and go, okay, what do I do?
What do I do? Yes.
Exactly.
Yes, and it doesn't have to be very complicated. It can be very simple of, for the most part, these top 5 are a very, very good guideline. Good multivitamin with minerals, and multivitamin with minerals has depending on which one, because, you have some basic ones and you have some more advanced ones. And so, at my store, I have a lot that are more advanced because I specialize more in nutrient deficiencies and hormone replacement and thyroid and adrenal function. So a lot of those conditions need certain minerals and substances for that whole metabolic hormone process. So I have a little bit of specialty products for that. But a multivitamin, you can get a multivitamin that has a really good amount of vitamins plus minerals, and it just has a small amount of each of them. And really, that's all you can do. You can't fit a ton of these products in these tablets in one tablet. If you go to more specialty type 1, those have a lot in them, but your daily dose is like 3 or 4 capsules per day. A multivitamin, you can get away with just one simple tablet a day, but it's the basic, middle of the road deal. But it's better than nothing. So even if you're absorbing 10% of that, you're getting something and you're complementing your diet. So regardless of what product you pick, as long as you're picking something and taking something, you're getting something out of it. Yeah, okay, so those are your top 5. So in conclusion, if you're still unsure of what vitamins to take, what supplement that you could benefit from, you just have to ask. Yeah, ask your medical provider, ask your doctor, ask your pharmacist, ask the questions. Be prepared to have the answers if you're asked questions like what medications do you take? What conditions do you have? How is your diet? Do you have access to healthy foods? Do you eat healthy foods? Those sorts of things. Those are all important parts.
I noticed that calcium didn't make the top 5.
Well, it could have been in the top 5. Calcium is included in that multivitamin, and calcium is recommended for any woman over 30. It could be, I should probably put it up there right up with vitamin D. Calcium and vitamin D, they often go together.
Now, what about K with it? I started taking K with my D and calcium.
You can, they'll do there'll be products out there that'll have calcium, magnesium, and then a small amount of K in them as well. K is a fat soluble vitamin, and it is essential for proper blood clotting and then bone structure as well. So they'll put a small amount of K in some calcium products. You won't find it in many. So that's more of a specialty type bone product. But your average like Oscal or Citracal, those are just calcium plus vitamin D. So that kind of goes along with that slide that I asked you. What is your goal?
Yeah.
What are you trying to treat? Are you at risk for osteoporosis? Do you have a fall risk? Have you fallen? Have you had a bone scan that shows some bone loss? Well, then in that situation, your goal is to supplement, maybe with the top 5, but adding the calcium in there as well. So, and it doesn't mean 5 different supplements. You want to find a supplement that has all of those in it. So you could get a good multivitamin that has a good amount of vitamin D in it and some calcium in it, but you may have to add more calcium on top of that.
I've had trouble finding a multivitamin because I cannot have turmeric and I can't have anything with a copper.
Okay.
So, I haven't read hundreds of labels, but I read a few and then gave up. So it was like,
Yeah.
okay, I really can't do a multivitamin, but maybe you've got, if I come and see you.
So you're gonna see on the shelf, some basic stuff. You really have to have someplace that does a little bit more specialty vitamins and has access to be able to order special, and there is 1.5 billion of them on the market, but on the shelf is just your basics. The more specialty vitamins you won't find as readily because they usually cost a little bit more and they're not as sought out as much. So not many people are looking for them, know about them, want to buy them. So they're more of like a special order type of thing. But it's very possible that you can find something that has a lot of the ingredients in it minus what you can't tolerate. So no turmeric, no curry for you then.
Right, and yet that's supposed to be, I had breast cancer and it was like one of the things that are promoted in the same with walnuts. But with the HER2 positive, and then I'm on an estrogen blocker and the estrogen blocker says, no, you can't have this stuff. So I mean, it's so contradictory, it gets overwhelming.
Yeah, for sure.
Is there a multivitamin in a capsule? Cause that's entering, that's a tablet.
So yes, you can find vitamins in tablets, in liquid form. They do make like a Centrum in a liquid form. And then you can find vitamins that are in capsule form. They're usually not like under the Centrum brand. Those are more like the pharmaceutical grade multivitamin, where you have to take, a couple of them to get what you need out of them.
Which would be a multiple.
Yeah,
I have a question that you may have the answer to.
I will try.
Supplements they're extracts.
Say that again.
The supplements that are extracts.
Okay,
Okay, like asparagus, broccoli, blueberries are all really good cancer fighting foods. They're
Yep.
very have a lot of antioxidants.
antioxidants in it, yep.
But I don't like this. I don't like to eat them. So, you can go to the store and buy, asparagus extract, blueberry and extract.
Yeah.
Are they as good? Is it the same
So,
as eating it? As
Yes.
you're eating the fruit or the
yes, so I don't know a ton about that, but what you're referring to are like, fruits and vegetables that are in a capsule form or a powder form, like athletic greens and different things that provide you the same nutrients and benefits, the same antioxidants as the fruits and vegetables. So it's my understanding that, and again, it probably has to do with the quality of the product, that there is still some benefit from getting those if you can't have those things in your diet. And even if you can have those things in your diet, you're probably not eating blueberries every single day or eating asparagus every single day and stuff like that. So the idea is to supplement your diet and add on to it. Yeah.
Okay.
There's a lot of products on the market. I know it's confusing. Yeah. Any other questions?
Oh, yes. Is flaxseed oil as beneficial as fish oil?
So flaxseed oil is beneficial. I don't know the answer to that question as if it's as beneficial, but I know that it is a good supplement for a lot of the same things that omega-3s are good for. So like even wise, I'm not sure.
So again, probably looking at your milligrams.
Yeah.
Okay.
Yeah.
And then zinc, they always talk about zinc for immunocompromised.
Yes.
Is that something a person should take every day? And what type? Because there's again, like the magnesium, so many different.
Yes, so probably just a basic zinc sulfate, I believe it is. And you can take it every day, but if you do, you don't need to have you only need so much of it. I think like 25 milligrams a day, because you can only absorb so much zinc.
Oh, okay. So you just eliminate it.
Mm-hmm,
It doesn't store.
mm-hmm.
Okay,
Yeah, and it doesn't store, so you have to replenish it.
okay.
Yeah. You'll find zinc in a lot of products that are boosting the immune system.
All right, so you probably get enough with the other supplements.
Yeah, you just look at your labels. I mean,
Sure.
If you're taking cold and cough products that are immune boosting, they'll often have some zinc in it too.
Okay.
So it can get really easy to spend a lot of money, you
Mhm.
know what I mean? And with supplements, and then if you happen to pick up something if you have a cold
Mhm.
that's boosting your immune system, it'll have zinc in it too. So then you're kind of you're doing a little bit of double dipping there. So it
And
may
then just
not,
eliminating it anyways.
yeah, mhm.
Yeah, okay,
It's not hurting you.
sure.
You just may not be doing a whole lot extra. So.
Thank you.
All right.
It was very informative.